Here's a quick tutorial on basic heart anatomy in blood flow order on a chest x-ray. We'll look at, start this view on a PA chest. Now we can see we have the superior and inferior vena cava bringing blood to the heart. You can see those in the chest x-ray here on the left as number 1 and 3. Blood now enters the right atrium, which we can see the contour over there in number 2. Blood exiting the right atrium, going into the right ventricle through the tricuspid valve, enters the next chamber, which we can see here as the right ventricle. This is going to be more anterior and it's really overlaid on the heart, so we don't see it as a distinct contour from this view on the chest x-ray. Just know that this is its location. So note the base there of the pulmonary valve. It's going to be the base of the exiting vessel, which is the pulmonary trunk. We can see this main pulmonary trunk coming up, splitting over into the right and left pulmonary arteries. It's identified as number 5 over on the left, so you can sort of see where the contour would be there, as well as the vessels filled with blood as they distribute out towards the lungs. Now returning blood from the lungs that's been freshly oxygenated comes into the left atrium, which we can see takes the entire expanse of the posterior aspect of the heart, and then exiting that left atrium down through the location of the mitral valve. We're not really going to see the mitral valve from this perspective, that's just the location where it's at. Now we've entered into the left ventricle. We can see the contour of the left ventricle over on that right side, indicated number 7. Now the blood is going to then leave that left ventricle via the aortic valve and go into the aorta. So this is the shape of the aorta. It looks like a candy cane, but not side to side. It's actually heading back. So it runs along the body of the vertebrae. We can see that over here as the aortic knob in number 4. We see it as labeled as the aortic arch here, but it's usually referred to as the aortic knob. So from this view, we can see all of these features overlay right here on a chest x-ray, knowing that on the outline we're only seeing a few of these, but this should give you some perspective as far as where the locations of these structures. Now you should be able to look at this chest x-ray and be able to recognize some of these contours more easily. Okay, so let's do a recap. We have the superior inferior vena cava bringing blood in. It arrives at the right atrium. We can see the nice contour there. Then goes into the right ventricle, which we don't see from this view. Exiting the right ventricle, going out the pulmonary trunk to the right and left pulmonary arteries. We can see just the tip of the trunk right there. Then blood goes to the lungs, comes back, and we can see just the atrial appendage at this location here, the contour there. It would bulge up if we have an enlarged left atrium. Blood then drops down into the left ventricle. We can see the contour of that right here. Incidentally, below that, this is just a gastric bubble. So this is the diaphragm. This is just air in the stomach. So just ignore that for now. And then we finally see blood exiting the left ventricle, going out the aorta. We just see this sort of aortic knob, which is a representative of the aortic arch. And then we can see the aorta as it travels down there. Now moving forward, let's look at the lateral view. From here, we can see superior inferior vena cava. We can see the contour of the inferior vena cava over there on the left at number 3. Moving forward, blood goes into the right atrium. We are not going to see an actual contour for the right atrium on this. This is just telling you where it's located at. Then we move forward into delivering blood into the right ventricle. We can see that the right ventricle is going to be the most anterior of the chambers. It's going to be just under that anterior thoracic wall. The contour is indicated over there in number 4. Blood exiting the right ventricle, going out that pulmonary valve, and then it goes through that trunk and then off to the right and left pulmonary arteries. Number 5 is going to be where it just goes straight over. So it's just going more lateral, that's going to be the right, where number 6 is actually an arch, where we can see that as the left pulmonary artery. So 5 is going to be the right, where it's just traversing straight across to the right side, where the left, we can actually see it going a little bit more posterior, so it creates more of an arch. Now blood returning goes into the left atrium. We can see how quite large it is, and it forms this posterior region identified by number 1, that contour. And with left atrial enlargement, it's that contour that's going to enlarge posteriorly. Here's the left ventricle, where we can see that posterior region of the left ventricle identified by the contour shown as number 2. Now blood exiting the left ventricle is going to go out this aortic arch. We can see it makes a nice candy cane shape going from anterior to posterior, and we can see that contour a little more clearly there as number 7. Now here are all those structures overlay upon each other with the labeling. So let's recap. We can see the inferior vena cava down here entering the right atrium. We won't see the right atrium, but we can see the contour for the right ventricle. We can see that right side outflow going into the right and left pulmonary arteries. Then we can see it returning to the left atrium, down into the left ventricle, and then out the aorta. Now you can see both views. Hopefully you can identify each of the numbered features a little more easily than you could before.